Hello, everybody. My name is Sergio Silverio, and I work as a research associate in social science of women's health at the Department of Women and Children's Health at King's College London. This poster is going to go over one half of the PEONY study, looking at the women's perspectives of hypertensive disorders of pregnancy. The PEONY study was led by Professor Deborah Bick, now at the University of Warwick, and I'm presenting on also behalf of my colleagues at King College London, Amanda Bai and Yangxin Chang. So just a brief introduction to the study. Hypertensive disorders of pregnancy are very common, and although disputed, it's thought to affect between 5 and 10% of women. It includes things like gestational hypertension, chronic hypertension, preeclampsia, eclampsia, and eclampsia imposed on chronic hypertension. And it's said to be the leading cause of direct maternal deaths globally. Internationally, there's little agreement on the consensus on HDP diagnosis, which is why this work is so important. This is the first study to explore in depth the views of women and healthcare professionals. And if you see the talk that we've also got in this conference, you'll see the healthcare professionals' data. And to understand how postnatal care was received by women, but also the barriers and facilitators to seeking healthcare in the postnatal period. The method of analysis, it was a longitudinal qualitative study at 4 and 12 months postpartum. We had 15 women who were diagnosed with preeclampsia, 7 with chronic hypertension, 2 who had pregnancy-induced hypertension. We used a thematic analysis. Those of you who are familiar with qualitative research will be familiar with the Brown and Clark 2006 thematic analysis, and that's also what we used here. We were quite consultative. I was new to the team when we started to analyse, so analysis had been started and then I took over, and it was a consultative and iterative process, very much inductive, very much rooted in the data, not superimposed themes for this analysis. So what did we find? So overall, we had 5 main themes that were identified, each of which had sub-themes, but given the brevity of this talk, I won't go into the sub-themes. The 5 themes are presented here with illustrative quotations from various women, so I'll let you read those, but in summary, they are assumptions about normal blood pressure, perinatal experiences, postnatal care pathways, managing complex health conditions, and women responsible for their own care. And this will be echoed in the healthcare professionals' data, which if you look at that talk, you'll also see. So what does this mean to us? Well, it means that women's postnatal care has long-term health and well-being effects, and on the outcomes of future pregnancies and life course health. Women's adherence to medical advice can be influenced by an array of factors, whether that be their own health, their time, or their healthcare professionals. But women's hypertensive disorders throughout pregnancy leaves them vulnerable to some psycho-emotional burden as well as physical healthcare issues. So the implications of this is that attention should be paid to if and how clinicians are implementing the NICE guidelines, and more focus should be placed on them. Plus, clinicians require a greater awareness of the implications of hypertensive disorders of pregnancy. And we really need to start dealing with the psycho-emotional issues that are attached to hypertensive disorders of pregnancy, and that can be dealt with better postnatal planning to ensure that women are healthy over their life course. very much for listening.